All right, good afternoon, everybody. It is 4:02. We're late, actually. On Tuesday, May 10th, 2022, we will bring this Personnel Human Services Committee meeting to order. Roll call, please.
Johnson.
Here.
Krieger.
Yes.
Fox. Here. Begic.
Here.
Coonan.
Here.
Radke. Here. Harris.
Here.
Warren present.
Thank you. First order is the minutes from April 19th, 2022.
I'll move them.
They've been moved, supported. Any discussion? Seeing none, all in favor?
Aye.
All opposed? All right, we will move on. So now is the time where we come to public input. If there is anyone out there who would like to go ahead and address the committee, you are more than welcome to do so. You can go ahead and sign in. You have 5 minutes.
5 minutes, that's amazing.
That is, it's a large length of time.
For you?
I think he'll do okay.
You're down to 4.5.
It could be anything at that point.
Yep.
And almost like a filibuster up here, 5 minutes. Yeah, good afternoon, Commissioners. My name is Brian Harrison. It's been a minute since I've been to your board meeting, and it's good to be back. Thankful to be back. I'm here working with AdvisaCare Home Care. We're a home health company across the state, working to continue to shed light on the challenges that our families and Michigan residents are facing regarding the Auto Insurance Reform Act and some of the government-mandated pricing that we're, I don't want to say working through because it's not really working, that we're unable to sustain much longer. We do know that there have been several counties locally, around 20, 21, 22 in total, but several locally that have passed similar resolutions urging the state to address this issue. And with home health, we do believe it's something that was unintended. The MCCA, the Michigan Catastrophic Claims Fund, back in even 2019 or 2018, before the law was signed, actually had set standard operating procedures that each home care company would have to go through and get quotes for services before rendering actual quotes for care in the home. And so there was already a lot of price checks in play for services that we as a home care entity would provide. It wasn't this, we charge and collect whatever we think we want to, and well, that person was injured in an auto accident, so we're going to charge 4 times as much because we think we can. That wasn't the industry in the world that we lived in. So now, fast forward, we have been, again, under this government-mandated 45% price reduction for almost a year now, and quite frankly, don't know how much longer we'll be able to care for these folks. We have been advocating tirelessly in Lansing, along with others. We recognize it not generally a county-delivered issue, but we do believe it to be important from a local perspective in terms of bringing that awareness and sharing what's going on. And so again, our hope is that we, and you as a board, would consider adopting that resolution at some point to urge the state to amend truly nothing more than the unintended result of the bill that passed. We're not asking to take the law back to mandatory coverages or mandatory unlimited coverage for folks. We value those choices now that drivers have, and we value a lot of the things that are in place, acting as a cost constraint with respect to utilization review. I know one of the commissioners here, I'm sure, has dealt with that from some time, given his work as a PA, but utilization review is a standard check and balance that most insurances like Blue Cross Blue Shield do have in place when working with their claimants. This was something that was not in place prior to the 2019 reform, which we believe to be a good thing now that it's there. So any company or provider that chooses to try to charge more now has a check and balance that is a standard with utilization review. And so what we're asking for, again, is a resolution working with the state to amend this and ultimately lift that cap, because we're having a hard time coming up for any oxygen as we're continuing to try to work with these families and these patients that have this coverage, purchased this coverage, and was promised this coverage, and now is certainly at risk of losing it. So I don't think that was quite 5 minutes, so I won't take my entire 5. But I know not supposed to probably ask or answer any questions during this time, but hopefully we'll be on the agenda soon, and we could have some additional discussion on this topic, and again, answer your questions as it relates to this. We know it's a big issue. We know it's, again, not a traditional county issue. But again, given the work we're doing in Lansing, we've also resorted to coming to the counties because we're desperate, and we don't know who else to ask for support other than other elected officials such as yourselves. So we, again, thank you, and It's great to be back. It's a beautiful building, beautiful room, beautiful building. Great to be back here. So thank you all. I didn't write my name down yet, so I will do that now.
Thank you, Brian.
Of course. Yeah.
Is there anyone else that would like to address the board?
I've been here a lot more than him.
Yeah, I know.
I'm Christy. I'm with Advisacare, so I have less to say than he does because you will see me more often than you see him. But I just want to piggyback on what he said. You guys know why we come to the county commissioners so that we can get, an army really to really press the issue of how important this is. Yes, thank you, Brian. And like Brian said, there has been 23 counties now that have adopted a resolution. Recently, this past week, which we've been a part of, was Genesee County and Midland County. So we are just really looking forward to being put on the agenda so we can answer questions, offer some clarity to some of the misconceptions that are out there. And that's all I have this time. And now I'm going to write my name too.
You've got to wait. You've got a whole lot more time.
I know.
Plus, you could have used up part of Brian's. So, anything else?
Thank you. Love the 5 minutes.
Yeah.
I do too.
Phil, it's nice not to be rushed, but I get it when you have to get through a lot of stuff.
Well, it's a pretty light agenda. We really could have stretched it out even further today, but there's some people that have, we've got some things to get to as well. So, absolutely.
Appreciate you guys.
No, thank you. All right, anyone else? All right, seeing nothing further, we'll move into petitions and communications. Letter A, Finance Officer, Bay County Audit, F65 Audit.
Support.
It's been moved and supported. Is there any discussion? Seeing none, all in favor?
Aye.
Opposed? That resolution will move on. Letter B, Health Officer, Kindergarten Dental Assessment Services Agreement.
So moved. Support.
It's been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Opposed? That will move on as well. So now we're under item C. So we'll deal with these. We've got Personnel Director vacancies. First off, we've got we've got number 1, vacancies. A, 911 dispatch. B, Buildings and Grounds custodian. C, Department on Aging site coordinator.
So moved.
Support.
Has it been moved and supported? Is there any discussion? Seeing none, all in favor?
Aye.
Opposed? All right, and now number 2 underneath item C is a new position.
So moved.
Support.
That has been moved and supported. Is there any discussion? Yes, sir.
I know that was talked about a while ago. Was that in the budget, actually, in this most current budget, Joel?
Yes,
Okay.
it was approved in the budget.
So we don't have to do a budget adjustment?
No, you don't.
Thank you, sir.
You're welcome.
Anything? Oh, yep, Mr. Begay.
Just wondered what sort of responsibilities you would be delegating to that person.
Well, kind of look at it as the vice president in the event of my disability or death or removal from office, one of the 3. That the person could step in, but also especially what's important this year, with the ARPA projects that are currently taking place, the time for me to do, more direct supervision of employees and programs is going to be less and less as I work more in the community to do this. And it's just a good thing to have a deputy health officer in place to help balance that, to help also have that continuity in place. And the other thing too is that if for any reason that if I should leave employment here in Bay County, or that that I'm just not available, you want to have that continuity in place. Now, currently we have kind of a loose chain of command at the health department, as who's next in charge, but this would be more definitive. And it, especially during this past 2 years, it was more than necessary. So it really needs to be in place. Most of the health departments in Michigan have a deputy health officer. It's a good opportunity for us to utilize this resources for this purpose.
Commissioner Krieger.
So Joe, going back in the day when you were a deputy, I'm assuming that there was a good job description at that time.
Yes, we
And-
have a job description already being worked.
Correct, and I'm hoping that it'll be polished up and there'll be added responsibilities as times have changed.
Yes.
From when you were the deputy, so I'm glad to see that we're planning for the future. I'm sorry that this wasn't done sooner for you. Back in the day, you had a big responsibility and shoes to fill when you left that deputy position to take over what McGregor had left for you, and times were tough then, and you stepped up to the plate and did what you had to do, and you've really carried the burden, so I appreciate all that you've done, and hopefully this will give you some freedom to spread yourself in other directions that need to be addressed, so thank you.
Thank you, I appreciate that.
Executive Barsham.
Yes, Joel, I want to thank you for your stellar service over these last 2 years and prior to that. And as Commissioner Krieger just mentioned, it's been a little over 6 years you haven't had a deputy and not even someone to help type your correspondence or answer those thousands of incoming emails. So I want to thank you, and I certainly hope you're not contemplating leaving Bay County. We would be devastated if that.
Somebody's got to pay my mortgage and put my kids through school.
Well, thank you, Joel.
Any other discussion? All right. Seeing none, it has been moved and supported. So all in favor?
Aye.
Opposed? All right, that resolution will move as well. That brings to a conclusion any of our petitions and communications. Any referrals? Unfinished business? None. New business? Miscellaneous? Yes, sir.
So there's been some activity with Bay Future and them posting or looking for some federal aid. I guess what I'd like to do is maybe look at having Trevor come in. I don't know if it's something we could do next week, to just kind of give us an update of where we're at with the program, if that's a possibility. And, you know,
She's our
Yeah.
liaison.
And happy to announce Bay Future, they're live right now with the small business grants. Applications are available now, so all online applications are available now through May 31st, and it closes at 5 p.m. More information can be found on their website.
You said it closes May 31st?
May 31st
5
at
a.m.
5 p.m.
All right. Thank you. Yes, sir.
Casey, being that you're our liaison, these businesses that apply, what do they have to provide? Do they have to show that they were negatively impacted?
They have to prove, correct, that they were negatively impacted. So there's an entire questionnaire, and then pretty much they're going to be rated.
Okay. Do they have to open up their books? I mean,
For that, I am not 100% sure. I know that they have to provide, let me go ahead. Grants must be used to reimburse eligible business-related operating expenses that incurred from January 1st, 2022 through April 30th, 2022. So would it be safe to say that they have to in their books?
Depends on how you're defining opening their books. Are they going to be subjecting themselves to a forensic audit? No. But they're going to be providing documentation and certifications to Bay Future indicating that they have been negatively impacted and show what their operating costs are for any given month.
Executive Barsham, go ahead.
And also, I failed to bring it to the meeting. However, in my office, Commissioner Kuhn and I have a copy of the actual questionnaire that the small businesses will fill out. So I'll be happy to provide that to you after the meeting.
yeah, because I remember a discussion we had, and but that's all right. I just wanted to make sure that we're following through on what we discussed a number of months ago.
Yeah.
so I guess if everybody's comfortable with how things are, then maybe we don't need to have Trevor come in.
It wouldn't hurt.
It wouldn't be a bad idea.
Next week
Just
would
to
be
kind of
good.
give you a state of things,
Okay.
so that way you get all your questions asked.
So we can do it next month then.
He could bring a plug-in for exactly that, though.
Well, that's, the more exposure we can get out there and questions asked would be better.
One thing I want to add to what all of you have said, I saw him last week, and the one thing he made a point to tell me, these grants are not first come, first serve. So you apply on day one, or you apply on the last day, you have an equal opportunity for that assistance.
Right. Because I believe, as Casey was explaining, they're going to go through and rate the need.
Correct.
Or what type of things they're looking for to move certain people up. Like
Correct.
if you've gotten a grant previously through them, then you might slide down the order a little bit, as opposed to those who have not. If you're a local small business, you move up in the order, as opposed, so they have like there's supposed to be, I believe, a weighted scale through their questionnaire. So it's open for anyone to apply during that period. When the period
And then they
closes, then they
close
go
it.
ahead and rate everybody, and then they've got a time that they disperse, I believe. Yes, Commissioner
Thank you.
Krieger.
The other question I have, so individuals that may have been damaged in 2020, 2021 are applicable to this? It's only from January of 2022 to April?
No, they can show that they were negatively impacted for any period of time, but what they're going to be reimbursed for are going to be those operating expenses that they can show substantiation for through their business records for those months.
Okay.
Anything else? All right. Any announcements? Commissioner Begic.
Memorial Day, it'll be the 30th, there'll be a lot of activities, there'll be in the paper, right up of all the county building and the vets memorials around town. I also brought in my Neighbors of the Bay magazine. Mr. Goulet is not here today, but I'll put him on TV. His family is features, very nice article about the family.
Yeah, nice
It's pretty accurate.
It's a nice picture.
Yeah.
Mr. Chairman?
Yes.
If, I know we don't interact during public input, but I want to thank both of the guests today for, again, continuing to, shed attention or direct attention to the, difficult situation that many brain injured or spinal cord injured victims who have been victims of vehicle accidents, like the vast majority of insured motorists, I have retained the unlimited medical benefits. However, that won't work if you don't have providers. And the rates that the legislature passed make it unfeasible for you to continue to operate. And it's my hope maybe the board will, soon, sometime, also take a position and join the other 23 counties that have. I know I was not supportive as I reviewed the implications of that, because we have Rivers Bend here in Bay County, and I'm trying to think of over in Tuscola County, the parents of Mike Wilson. I'm trying to, it's been many years. Yeah, the Lighthouse. But they provide critical care for severely injured victims of automobile or vehicle accidents, and I know that home health care too has been impacted. You can't provide that kind of service and care for the limited amount of money. As I recall, I think it was 40% reduction in reimbursement costs. 45%, yeah. So, but thank you for coming, and I think there's a lot of people who are supportive of what you're drawing attention to, and hopefully the legislature will correct their mistake.
Mr. Chair,
Yes, sir.
I'd like to make a motion to adjourn.
Motion to adjourn?
Support.
It's been supported. Any discussion? All right. Then I guess, let's do a vote. All in favor? Let's get up.
All right,